Hi, this is Dr. Raj with another episode in the Mohan Minute. Today I'm going to talk about a very important topic that's come up over the past few years, which is breast implant illness. To summarize, some patients who have breast implants, not all of them, but a small percentage, do have symptoms related to them, such as fatigue, hair loss, depression, muscle pain, joint pain. They don't have any other conditions that are causing these symptoms, and it's primarily linked to the breast implants. Now, this is a topic that's discussed in many of our journals and meetings and in many media forums. And the main thing to keep in mind here is what treatment helps for this. Now, there is a lot of debate on it, but from what I know, definitely implant removal is a necessity, but the big question is what to do with the capsules. Some people feel you could have to remove the whole capsule, which is total capsulectomy, or do partial capsulectomy. Some people feel that the capsulectomy should be done en bloc, meaning that the implant is taken with the whole capsule without cutting into it. Now, even though there's a lot of debate and different schools of thought, we still have to do more research to figure out what is the best treatment for this particular condition. And I always tell patients the best thing to do if you have questions or you have concerns about your implants is always consult with a board-certified plastic surgeon to get your questions answered. Thank you for tuning in.